I have now.
Great. Thank you. Sorry, I meant to start off with that and I didn't. So this will be recorded and posted to the Resource Hub and the slides, just as Mike has done in our previous Q&A and special ed update sessions. And so first off, I'm going to turn things over to Tina Wilkerson to go over some of these special ed instruction updates.
Hi, everybody. I wanted to start by first just reminding everybody about the Special Education Resource Hub. This is the resource to all things special ed. It's one-stop shopping. You can find links you need. Any updates or information is there. Specific examples of schedules are there. So it's a really great place for both you as an administrator and your staff. Secondarily, we are starting to look at a phase-in plan for special ed. As you probably heard if you watched the school board work session or if you were at the principal's update meeting. If you were at the principal update meeting, you heard that PAC, preschool autism classes, and early childhood class base will be the second group to start with specific high school classes starting on September 28th, and then PAC and early childhood class base starting on Tuesday, October 16th. As we start this, we're starting to put in our phase-in instructional supply list, so you will also find those on the hub. We're working, Ellie and I, for Cat B, secondary and elementary, and you will see those very soon there. While there hasn't been a specific exact date yet in the draft to the next school board presentation, we think that it may be in October, mid to late October, that the Cat B students will start to come back to school. There's still some work that needs to be done around that. As you start to get more information about the phase-in plan, we've as I said, put some resources in there for you all to look at. We also have added some digital tool use, and we wanted to just remind you to remind your staff, and we'll be talking about it also at both the lead and department chair meeting, that some of the kids may be having difficulty with use of digital tools. So we're asking that staff monitor that use and make sure that they have the skills to navigate those tools, so that they may, and if not, it may require some explicit instruction. So it's some explicit instruction around that. Another thing that one of our school board members shared and has concern is the student connections with peers. And as you all know, and as your teachers are so good at, there are many ways of connecting students. And so we want the staff to be aware of the needs to navigate the virtual social world, just as there's a need to navigate our face-to-face social world. And we're asking that staff create opportunities to connect other classmates to other classmates as part of instruction. And we'll share that also when we go to department and department chair meetings. Also, there was an infogram that was sent and extending the deadline for all of our professional development. So that deadline has been extended to October 12th. And we just wanted to make sure that you knew that, and that to remind you of that for staff. And then finally, we're asking for flexibility in scheduling service delivery time. We know it could be on Monday, but we're also finding that we as teams, as IEP teams, need to work closely together to figure out the time to schedule both service delivery and related service hours. So scheduling all of that together. We want to make sure that as we work together and collaborate, that the schedules work as efficiently as possible, both for the teachers and for the related service providers. That's it for Office of Special Ed Instruction.
Thanks, Tina. Okay, From the Office of Special Ed Procedural Support. So many of you probably already know this, but you see first on the slide about our upcoming department chair meeting. It's Monday, a week from today. We offered 2 sessions so that it offered your chair some flexibility to work it into the schedule. There's an AM or a PM session. Please have them use the MyPDE course number and sign up in advance. That's very helpful for the clerical staff. So at that meeting, there will be updates that are really critical for your chair. If you have co-chairs, you know, all of them can attend, and there will be updates from the Office of Special Ed Instruction, from our Office of OSEPs, and it's a full DSS look into things that you need to know and continue with having a successful opening of school year. One of the highest frequency asked questions is around hearing screenings. I wish that I was giving you today some concrete, really good news on a clear path. There's still some unknowns, and that is because we're waiting for a little bit more from the Fairfax County Health Department for their help with this. They've been asked to do a number of things. That we need our health services that we would have had during any other traditional year, especially as we deal with our special education screenings for special education evaluations. And then also eventually, as you just heard from Tina, as some groups dial in and phase in to school, we will be asking for support in the school. But so right here on your screen, you'll see that the Health Department has proposed that they will be able to provide some school health aides or SHAWs to serve on a rotating plan for pyramids. The details of that are not ironed out quite yet, but so that is coming. They have promised to try and help us, but that it has been a little slow. You know that the hearing must be screened for every student who is undergoing an initial evaluation. And even though you all are secondary, there are still some initial evaluations that occur at the secondary level. So we are trying very hard to make sure that we can comply with the requirement. Vision is actually not required. It is a best practice, and so we often pair up hearing and vision screenings. The Virginia Department of Education, responding to this question, has said that there is some latitude to use any records you have in the student file from a couple years back. They don't want it to be too old, but if you have any of the physical screening results from previous evaluations or from previous processes, including the new student screenings that happen at various years, K, 3, and I believe 8. So any of the new student screenings that exist in your file, if you have those results, those can be used to fulfill the requirement for the hearing screening for your students who are in the local screening process. The other thing that we recommend is that you can go to eligibility without the screening and then circle back later. You can explain during eligibility that there are no current concerns, if that's the truth, with vision and hearing, and we're going to proceed with the eligibility and then can come back to a screening if there's a need to at a later time. Also in the works is a possible plan to train some school staff to conduct hearing and vision things. Again, sorry that there is not more concrete detail to that for you today, but we are working on it. Lorraine Trouton is working really hard to get the health department to help us with this, and we will be back in touch through either one of our meetings or likely an infogram once we have something concrete to share on that. All right, so the next thing that is a frequently coming up question are the topics for parents who have advocates and attorneys especially, and those even who don't, but asking your IEP teams and case managers about what's going to be done for a student who has missed a great deal of service. Now, all children have missed service, but a lot of our special education parents believe that their students is eligible for a compensatory service. So we shared with you all previously that the Virginia Department of Education came out with a guidance document on this topic end of July, and we shared it out in August, that says really compensatory services do not fit the circumstances that we're in right now with the COVID-19 shutdown of schools. Instead, they coined this phrase that you see called recovery service. And so their recommendation is that school divisions, schools, and teachers keep a lot of good documentation and data collect it and maintain it on their students for the purpose of considering whether or not a child requires a recovery service. So more is coming on this topic, but what is critical right now, I know it's only the beginning of the second week of school, but your case managers need to be thinking in terms of collecting any data that was pre-COVID on their student. Collecting any data that was available from the springtime during the continuity of instruction, collecting any data for any students who attended virtual extended school year. Didn't put that on the slide, but that one also is important. And then now, as you're in fall virtual school, there's a lot that needs to happen to look at the students' goals and collect as much data as the teachers can, so that the IEP team has data with which to make a decision. You should be using all and any informal means of collecting progress monitoring, especially those students who participate in general curriculum, either through a special ed class or a general ed class. So our colleagues in general education are using curriculum embedded assessments, mini assessments, informal and some formal like the DRA, Horizons mini assessments, and all of those things should be used especially with our students with disabilities who are participating in the general curriculum. And then for your students who are participating in adaptive curriculum, it's more about the IEP and the data that can be gleaned from progress on IEP goals. So we have a guidance document in the works with some charts and some information that is being designed to really help you with this. This is complex. It's not an easy conversation to have. I know you've been dealing with it. We've been dealing with a lot of parents who are upset and very concerned because their child is not getting any in-person services. Just like we did with our last guidance document, we are about ready to solicit input from the association representatives. So we will reach out to them very soon. And if any of you just have an interest, maybe this is a topic that is coming up in your building and you would like to give some input to us, please reach out to Debbie Lorenzo, as she's been the lead on our development of this guidance document. So I'm going to pause there. I want to see if I've forgotten anything. Let's see. I think that's everything for the recovery service to date. Debbie, do you want to join in and say anything that I might have forgotten?
No, I think you covered it. I think where the hopes, once the document is together, is that we're hoping to do a recording of it as well so that school teams can use it with their teachers as a way, as they review the document with them, they can also listen to the recorded session with the procedural support liaison.
Great.
So if anybody would like to, provide some input, please, like we did with the IEP guidance document, just reach out to me.
Great. Thank you. I see we have a hand. So Kim Retzer, go ahead.
Good afternoon. I'm just going back to the previous section about the hearing and vision screening. And we're all trying to deal with ADA accommodations and teleworking guidelines and staff wanting to do that. Who might you foresee doing vision and hearing if that falls on school-based staff?
That's a good question. Thank you. We've heard that in some schools just on their own that either office or special educators have been tapped to do that. I will say that from my office, I don't want to put that on school-based staff. That's why we're working so hard to get cooperation from the health department. But like I said in the previous slide, and as you mentioned, it's possible that a plan would come forward to train some school-based folks. We would be happy to hear input on, if I know nobody is out there just waiting for more work to do. But the hearing and vision screens are generally very quick and simple. It's mostly the logistics of bringing in, working with the family and bringing them in for the appointment. So those are the things that we're trying to get ironed out right now. Okay, so at this point, we'll be happy to call on anybody that raises their hand and wants to ask a question. There's not a lot of new information to share today, but we've covered the high points of things that are in the works for you. Wow, okay. I'm not seeing any hands yet, but we'll wait because you might be absorbing it and thinking about what questions you have. Cindy, go ahead.
Thanks, Jane. I'm curious, as we do start to phase in, if we find that we need more like PPE items, do we go, specifically for like students in our Cat B program or something like that, do we go through your office, or is this something that the school has to buy separate?
I think I know the answer, but I'm going to let Tina answer this because she's been dealing a lot with this topic.
So there's a process that's set up through the warehouse. It's exactly the same as when you guys, if you ever have to request gloves through the warehouse, there will be a cost after the first PPE goes and is delivered at the schools. So you will have some to start that will be part of that funding for COVID, which should start you guys out.
Thank you.
So in terms of the phase-in plan, Tammy's question is, do we anticipate ID students or otherwise Cat B students coming back just on Mondays or on a different schedule? The phase-in plan in general is not about Mondays. It would be sort of similar to the hybrid where we're expecting 4 days a week if it can be worked out based on staff. And I'll let anybody else from OSCI that's on the call that knows anything. Debbie's been working with HR and Ellie and Denise, but I'm not sure if you guys have any other information. Denise isn't back yet on this one, but Judy or Tina, do you have any other details?
No, that's it. We worked with, both Debbie and I worked with HR to get them the numbers of kids so that they could, and the names of the teachers so they could look at that piece to see who has ADA, how many teachers have ADA, and go through that piece of it. We have developed a database, not complete, but we're getting there, for both Cat B students at the secondary level, middle school and high school, that has their preferences. And as we look at this, we're looking at how can we kind of group kids together so it works for all. We'll see how that goes with ADA.
Yeah, I think the school board has been briefed on the idea that the students on adapted curriculum through the grade levels would come back in a phase-in plan for 4 days if we can make it work. So, anybody else? Greg, do you want to voice your question? Or let's see, I can look at it here.
Sure. I was just inquired earlier today. It's just back to school nights coming out. Typically, we get some information from the Office of Special Education and Instruction, just that information to go to the parents. Is there anything specific that's coming down that we need to be aware of?
I can ask Mike about that. I'm not aware of anything right now. Everything will go through Dr. Brabrand as far as that communication, but I'll ask him and get back to you.
MB.
Hi, I just wanted to ask, this is Michelle Beard from Hughes. I wanted to ask a clarifying question. You said that adapted kids would come back for 4 days, and we have some of our students that also, go out for electives. They have just unique schedules that are in our adapted program. So would they not be following the kind of A-B day schedule that everybody else is following, and how would we manage that with electives?
So we're still looking at that, making decisions around that, but they would follow the AB days as they normally would if they were there face-to-face. So we're looking at that piece, and then also the bell schedules. We would like them to be able to continue with their schedule, but the bell schedule may play a part in that. So we're still looking at that, making decisions around that.
Thanks.
Okay, I don't see any other hands, but we'll be on the call for a while longer if you want to hang around, if you think of something. If not, then thank you for joining us today. Okay, so Kim, yeah, the bell schedule will need to align. Do you want to voice that and talk about that a little bit more?
Yeah, I'm just thinking, like, even my adaptive PE teacher, he teaches regular sections of PE also. So I don't have that flexibility, to adjust, assuming that our Cat B kids are going to do their full course load. The chorus teacher has her sessions, they're at set times. There's not really that flexibility to create a secondary schedule for our Cat B population. I know we've been flexible right now with our timing of things and when we can incorporate breaks and those kind of things, but when we get to the point where they're coming back and it's, we're going to have to align that bell schedule a little more closely than maybe we are right now, where we're able to be a little bit more flexible in a completely virtual world.
Absolutely. We hear you on that, and we're also looking at the possibility that while they're face-to-face, could they access some of that virtually, some of their electives virtually.
Now, we've had that conversation here, just trying to figure that out, and I'm sure it's also on your mind. We have Tier 1 teachers who are Cat B, and what is that going to look like as far as supporting the kids physically in the building while they're watching their teacher do instruction online. And so that's another thing we're trying to process through and think about what the best practices are about that.
Thank you.
Right. There's some agreement on that, yeah. And then I think I saw Cindy. Cindy, did you take your hand back down?
Yeah, I was just going to say, I think when we talked about this last week that I had asked that question to Mike and Sloan, and that was, you know, looking at it through the online perspective of the electives, and then maybe kind of just restructuring, I think, is what they were saying too. So that's, if I'm understanding, that's what they were suggesting as well. So you had already started to talk about it. So.
Okay, thank you. All right, well, I hope that everything is going well in your buildings and that it continues that way. Please reach out if you have any questions, you know, that are specific that you didn't want to voice here. And if you want to give us some feedback on our guidance document that we have about to come out for recovery, we'd love to have more input and think through on that. And then some of this conversation about the phase-in plan, I know the OSCI team is working really hard on that. So thank you very much. Have a good rest of your day.